Tonight's Newsmaker is an obstetrician gynecologist turned healthcare administrator who runs, with nearly 13,000 employees, the Piedmont Triad's second largest employer. The changes she and this nonprofit organization are implementing could have a big influence on not only the type of health care you get in the future, but how much you pay for it. And for Cone Health, along with its president and CEO, Dr. Mary Jo Cagle, we're about to get some major help in this journey.
I would say that Cone Health is a vibrant, dynamic, community-focused healthcare system that is passionate about the people that they serve, passionate about this community.
And Cone Health, whose flagship 628-bed Moses Cone Hospital in Greensboro is part of a network of facilities that serves Guilford and at least 4 other surrounding counties, is facing the same challenge most healthcare providers are. And it's a challenge Cone Health President and CEO Dr. Mary Jo Cagle knows all too well. What is keeping you up at night?
I think our biggest challenge today is the same thing that moms and dads and families are facing, is the inflationary pressures that exist on the cost of everything from wages to supplies to the food that we buy, while at the same time pricing, what payers are paying us, is not increasing at the same rate.
And that's tough when you're serving a patient population that's already paying too much for health care, and you're trying to provide quality health care while struggling to meet your budget. It's not a new problem. It's why, for the last 13-plus years, Cone's been working to implement what the healthcare industry calls value-based care.
Value-based care is not about charging you for every time you see a doctor or for every procedure you have. Value-based care is about keeping you healthy and well and providing high-quality care at the lowest possible cost. We would rather you pay your premium, your cost per month, and we're responsible for providing you care for that premium all month long. Right. And if we can provide your care for less than that cost, then we win. And if it costs us more to care for you that month than what you paid, then that's on us.
Yeah, you take the responsibility and you could be penalized.
We could be penalized, and we get rewarded if we keep the cost below that, so that you don't have to worry about saying, oh my goodness, here's a big bill. You already paid your bill when you paid your premium.
A key part of that, from Cone's perspective, is using its 6 med centers, like this one in northwest Greensboro, to keep people in the community well enough to stay out of the hospital, where costs can skyrocket, from emergency care to primary care, among many other services. This med center even has a large place for patients and others to work out. What is this, and what does this have to do with value-based care?
Well, so it is a gymnasium, but this is, physicians refer patients here, and we have physical therapists or exercise physiologists that design a specific program for all of the folks in here to help them reach their physical goals, and it's reported back to the physician. Cone
Health is also carrying out this Keeping People Well mission in all its expansion plans, including a new $72 million med center under construction in Asheboro. Dr. Cagle even signed one of the building's beams earlier this year, and its coordination with North Carolina A&T State University to build a $32 million building off East Market Street called Resurgent, a big part of which will include urgent and primary care offices. It's part of Cone's Catch 5, In 5 initiative to improve life expectancy in East Greensboro by 5 years within 5 years.
Build where they live.
Yes.
Remove as many barriers as you can to people successfully getting good care.
Another big change, Cone's recently announced merger with Risant Health, a nonprofit healthcare giant Kaiser Permanente created in 2023. Dr. Cagle believes this relationship will give Cone Health everything from data analytics to resources to support home visits to keep people well and out of emergency rooms. How confident are you that Risant won't come in and overrule you on decisions that you make locally?
We're quite confident because we're maintaining our local board, which in other deals that we've talked through and about, we didn't have that happen.
Can you guarantee that with this relationship with Risant, no jobs will be lost or shipped out of this area, and Cone Health's headquarters will stay in Greensboro?
I can absolutely guarantee Cone Health's headquarters are staying in Greensboro. And if jobs are lost, it's not because of the partnership with Risant. Cone Health will have to make whatever business decisions we would make year after year based on our business realities. We're committed to this community for the long haul, and we're transforming the way care is paid for.
Dr. Cagle and Cone Health are not disclosing the financial terms of the agreement with Risant, but she did tell me Cone and Risant will share board members. Supporting more, the concept Cone will be an independent subsidiary and Risant won't overrule any of its local decisions. This agreement still needs regulatory approval. Dr. Cagle hopes everything will be finalized by the end of this year. Cone, by the way, will keep its name and all branding. To read more on my interview with Dr. Cagle, including more details on Cone's expansion plans, which include Winston-Salem and Forsyth County, look for this story, which we're about to post on our website, myfox8.com. To find it, click on the Spotlight tab at the top of the homepage, then the Newsmakers tab.